Hello, this is our project. The title of our project is Family Health in Mid and Later Life Congestive Heart Failure. Class is Nursing 480. We are group number 5. Our classmates in our group are Jamie Carroll, Trisha Delgado, Sia Bahan Lackey, Jasmine Lahudi, Allison Mongelli, Jeffrey Neiswanger, and Noli Raz. For our patient that we chose for this project, the patient is a 65-year-old Hispanic female, Geronima. Patient was admitted 2 weeks ago for chest pain, shortness of breath, and bilateral leg edema. He was seen in the emergency department and was diagnosed with acute MI with elevated troponin levels. Chest X-ray showed an enlarged heart. Echocardiogram showed cardiomyopathy and an ejection fraction of 18%. Some of her past medical history: she has a history of congestive heart failure, type 2 diabetes, hypertension, hypothyroidism, COPD. She also has peripheral atherosclerosis disease, also some mental chronic depression, chronic arthritis with unsteady gait, and chronic kidney disease. This patient lives in a 1-bedroom apartment with her husband. She has the support of two adult daughters who live nearby that help her with the doctor's appointment and her basic needs. She has 2 other children who live out of state who offers financial support if needed. Patient does receive Social Security and has a small pension from a former employer.
Hi, my name is Siobhan Lakey. This is the genogram of the F family. According to Kakinen, Coelho, Steele, Tobacco, and Hansen, genograms can have many functions based on the reason why the nurse is working with the family. The function of this genogram is to determine what type of aid family members can offer in the recovery of Geronima. As we can see, her husband, Hector, lives in the house with Geronima. Hector's retired, and he's available to assist Geronima often. None of Geronima and Hector's children are married, nor are parents. Geronima's and Hector's 2 eldest daughters, Anna and Sandra, live in the same city as their parents and are able to offer support and activities of daily living, as well as instrumental activities of daily living. The younger daughters, Brenda and Sonia, live out of state. While they can't provide hands-on care, they are able to offer some financial support. Next slide. Next slide, please.
Sorry.
Back one.
Back one, sorry.
That's okay. So this is the eco map of that's the genogram. And if we go one down. One more down, Noli. Noli, one down. Thanks. This is the eco map of the F family. According to Kakinen, Coelho, Steele, Tobacco, and Hansen, a family eco map allows for a visual representation of the systems that are outside of the immediate family that are sources of support or stress. The family genogram is in the center circle, and it's surrounded by smaller circles which represent the important elements with which the family interacts. The lines represent the quality and nature of those systems in relation to the family. In reviewing the lines shown on this eco map, we can see that the elements of support are strong, and the energy flows tend to be reciprocal for the most part, far outweighing the stressors for Geronima and her family. The families involved in their church and take part in volunteer activities. Hector and Geronima both have individual activities that provide them with support. Geronima attends a painting class while Hector goes fishing with friends. They belong to a Sunday round-robin dinner group with 3 other families and have many friends. The primary stresses are the tensions that occur between Anna and Sandra over conflicting decisions in the running of their joint business, a restaurant, and the family's discomfort with Anna's boyfriend, Bill, who has a rocky relationship with Anna for several years. Next slide. In reviewing functions and tasks of the family, there are several basic family tasks that are essential to survival and continuity, according to Duvall and Miller. to secure shelter, food, and clothing, to develop emotionally healthy individuals who can manage crisis and experience monetary achievement, to ensure each individual's socialization in school and work, spiritual and community life, to contribute to the next generation by giving birth, adopting a child, or foster caring for a child, and to promote the health of family members and care for them during illness. Next slide. This family is meeting most of the basic family functions and tasks. All of the individuals have shelter, food, and clothing through gainful employment or retirement funds. This family's members are emotionally healthy and enjoy non-monetary achievements primarily found in the family's involvement with church, volunteer activities, close relationships with friends and families, and recreational activities. Geronimo with her painting, Hector with his fishing. While the family is very close, there are sources of friction. One source of friction is the on-again, off-again relationship that Anna has with her boyfriend. Many of the family members feel he is not a stable choice for Anna and that he drains her. The other source of friction stems from the two daughters that live nearby disagreeing when issues arrive at the restaurant that they own together. However, in general, the joint venture has been a positive situation for the family. The two daughters are able to provide their mother with a great deal of assistance as they can cover for each other at the restaurant when one of them is away attending to their mother's needs. The sisters and father have developed appropriate ways of carrying out tasks, and this allows them to handle their mother's illness in a health-promoting way for the entire family. Next slide, please. On the transitions, according to Kakinen et al., family transitions are events that signal a reorganization of family roles and tasks and can be developmental, situational, or health illness. This family is going through a transition that certainly has elements of the developmental type, as the 8th stage of Duval's stages of family's development is the aging of family members. This stage goes from retirement to the death of both parents. However, due to the sudden increase in acuity of the mother's illness, it is also a health illness transition. According to Kakinen et al., it is important for nurses to recognize when families are facing a health illness transition because there is added stress in these transitions and the nurse can help the family plan for changes. One change that the nurse may want to discuss with this family is having a plan of action for the long haul. This may require more flexibility from family members in considering various options, such as hiring outside help, something the father resists. Outside help would enable the family to have some respite during what Kakinen et al. Refer to as the long haul. Outside help may diffuse additional tension between the two sisters who provide hands-on help to Geronima as they already have conflict due to their work. It appears that it would be financially feasible as well, as the other two daughters who live out of state are willing to contribute financially to help with the family's needs during this illness. Thank you. Next slide. Next slide. Oh, sorry.
So my name is Trisha Delgado. I will be speaking about applying the theory to the condition. I'm introducing the family systems theory. The family systems theory is viewed as the most influential framework in family social science, according to Kakinen et al. The family systems theory allows the nurse to assess individuals and their families as an organized whole, as well as each individual as interactive and interdependent systems. Family systems theory, according to Kakinen et al., also allows the nurse to assess individuals and their families as an organized whole, and each individual as interactive and interdependent systems. Maintaining and restoring stability in the family as a whole while achieving the highest level of functioning is the goal of the family nurse. There are 4 concepts that encompass the family systems theory. Next slide, please. Concept number 1 is all parts of the system are interconnected. Kakinen et al. States all the parts of the system are interconnected. When an individual in a family experiences a health event, all members are affected because they are connected. Geronimo's CHF has an effect on the entire family, especially her husband. He now has housekeeping tasks that he is not used to performing, such as cleaning, doing laundry, and grocery shopping. Geronimo's husband has enlisted the help of their 2 daughters that live close by for assistance with household chores and grocery shopping. Geronimo's husband has asked their other 2 children that live out of the area for financial assistance. Next slide, please. Concept 2, according to Kakinen et al., is the whole is more than the sum of its parts. Geronimo's entire family has been impacted by the stress of the chronic health condition. Her family will start to realize that their family has also had a loss of routine and ritual, as it represents a change in their family tradition and beliefs. Geronima may no longer be able to do things that she used to do for the family, such as babysit grandchildren or cook lavish meals for the holidays. Next slide, please.
Concept 3 talks about all systems have some form of boundaries or borders between the system and its environment, according to Kakinen et al. Families control the inflow of information and people coming into its family system to protect individual family members or the family as a whole. Families create boundaries that can either be closed, flexible, or too open to information, people, or other forms of resources, according to Kakinen et al. Geronimo's family has flexible boundaries. The family welcomes visits from the home health nurse and the Catholic priest, but turns away other members of the church as Geronima becomes tired from the endless barrage of visitors. Geronimo's husband is close to the idea of having an outside housekeeper come in to assist, and instead wants his daughters to help. Next slide, please. Concept 4, systems can be further organized into subsystems. Nurses need to not only look at families as a whole, but also as a series of subsystems, according to Kakinen et al. The nurse could look at ways to decrease family stress by focusing on the marital subsystem, the parent-to-child subsystem, and the sibling-to-sibling subsystems. Subsystems include the husband-to-wife, Geronima and her husband, mother-to-child, Geronima and her 4 children, father-to-child, Geronima's husband and 4 children, and sibling-to-sibling, Geronimo's children. Next slide, please.
My name is Jasmine, and I will be talking about family nursing interventions and outcomes. The first intervention we devised was for the family to participate in interventive questioning, for example, in a 15-minute interview. The rationale is to support the therapeutic relationship between the family and the nurse and to allow the discussion of concern. And the desired outcome would be that the family will be able to identify their strengths and their resources. The second intervention we devised was an exploration of the illness experience in the presence of other family members. This was a suggestion by a peer-reviewed journal by Dunhamel and Talbot. The rationale behind this intervention is to support the family relationship within the family and the nurse while promoting psychological health. The outcome will be that the family will be open to hear each other's view of the experience, and this will aid them in supporting one another. The nursing interventions perceived to be most useful and feasible for both groups of patients were the following: humanistic attitude of the nurse, constructing a genogram, interventive questioning, offering educational information, normalization, and exploring the illness experience in the presence of other family members. This is, again, by Dunhamel and Talbot. Next slide, please. The third intervention we devised was to educate the family, especially the spouses, partners, and adult children, the daughters in this case, who might serve as caregivers, on autonomy supportive communication. Autonomy support is a concept from self-determination theory and is viewed as being the opposite of criticism in terms of tenor of communication patterns. The rationale for this is patients who perceive their family members as supportive, encouraging, conveying confidence, and providing choices engage in more positive healthcare behaviors and behavior change. The desired outcome would be to promote a sense of choice that allows individuals to engage in behavior according to their values versus doing certain things because of controlling demands or threats from others. Next slide, please.
My name is Jeffrey. I'm going to be talking about some of the stressors. Family can be defined as a group of individuals having close emotional bonds who meet affectional, socioeconomic, and socialization needs of one another and of the family system. That's by Newby. So congestive heart failure, along with the patient's multiple other comorbidities, they can create a lot of numerous emotional, socioeconomical, and social stresses for both the patient as well as the family. Anytime you have any health disparity, you need to go and look at the fact that it affects not just the patient, but also their family, their husband, their children, their parents. One of the things to go and think about is the financial burden of the ongoing care for this family, for medical expenses, for follow-up appointments, for pharmacological therapy. The fact that they may be going and losing wages, as one of the daughters will be tending to the mother and the other one will be looking at work. The cost for any anticipated caregiving in the future as well. That's something that needs to be taken into consideration. Another thing to think about is the limitation of physical abilities as this condition can be detrimental for the patient. It puts a lot of stress upon the family members. Things that this patient was able to do for herself previously, as this condition and her other conditions worsen, she's going to become more and more limited. And as we have explored earlier in the slide, we see that the family isn't necessarily open to having a whole lot of other outside help. So it puts a lot of stress on both the children and on the husband. Another thing to take in consideration is the uncertainty of this disease, of this illness, and the fear of the unknown. Anytime you have any patient, any individual who is sick or has a exacerbation of a condition like this, the idea that death may be near, or that they might not be at or that their ultimate health might be changing, is something that is very difficult for people to go and cope with. Next slide, please. Acute exacerbations of congestive heart failure are actually associated with hospitalizations. It's the third most common cause of any hospitalization among all patients, and that's across the board according to COFFEE here in the United States. With this, the family's health and wellness, that they're at risk because of the hospitalizations and these acute exacerbations with this chronic illness. As we talked about before, the medical costs, the fear of worsening symptoms, and the emotional stress associated with it. The roles that the adult daughters who are nearby and the roles and the responsibilities in their mother's care are things that need to be taken into consideration. Now this husband is alone at home, and he's going to need emotional help and support as well as the wife. Next slide, please.
Implications for family nursing practice, influences on the family nursing practice and research. So despite numerous advances in drug and device therapy, the morbidity and mortality of congestive heart failure remains unacceptably high. CHF afflicts over more than 5 million people in the United States, with an incidence of over 500,000 cases per year. And the lifetime risk of heart failure approaches 20%. And this is from Garcia and Touchard. Another statement here is congestive heart failure is a leading cause of hospital readmissions among patients covered by fee-for-service for Medicare, and then that this was also quoted from COFFEE et al. Multiple factors may contribute to the return of the patient to the hospital. Many of the patient's comorbidities, patients non-compliant with medical therapy, inadequate treatment at initial hospitalization, failures in discharge planning, maybe even severe progressive of the illness. Other factors include access to quality outpatient care and social support systems. A lot of hospital readmissions may adversely affect payer and provider costs and patients' morale. Another statement regarding some of the research that I found was the nation's inpatient hospital bill for CHF was $10.7 billion in 2008. Thus, reducing CHF hospital readmissions represent an opportunity to reduce healthcare costs while increasing the quality of patient care. Congestive heart failure is a serious disease. As nurses, we must ensure that after an exacerbation, that the patient is followed up after discharge, and also teach the patient about medicine compliance, low sodium diet, monitoring weight, and fluid restrictions. To prevent overload is an important management in this disease. and many other that were also mentioned in this in our project here. These are the references that were used in this project. Page 2. And this will conclude our project. Thank you.
Thank you.